Thank you for the opportunity to be a part of the celebrations for Caribbean Public Health Day, recognized on July 2nd. This day also marks the anniversary of the legal establishment of the Caribbean Public Health Agency, CARPHA, a critical partner of the Pan American Health Organization. Over the years, the Caribbean has experienced emergencies and threats: hurricanes, flooding, volcanic eruptions, and more recently, the COVID-19 pandemic. These events have changed the world, impacting economies, lives, and livelihoods. But these difficult times have also stressed the value and necessity of public health. Even as we work towards exiting the pandemic, the question has been asked: is COVID-19 transforming public health? People everywhere and all systems have been impacted and altered by the pandemic. Our health systems have not been excluded. Preventive measures used for epidemic control, like social distancing and contact tracing, have now become household phrases. Discussions on the need for available, well-trained healthcare workers to meet the needs of the population in a timely, relevant, efficient, and effective manner are more relevant now than ever. Finances have been reprioritized to address the pandemic. At the same time, adequate health financing is necessary to ensure successful outcomes through additional staff, equipment, medicines, and health technologies. Like other viruses, COVID-19 thrives on inequity, causing substantially higher mortality among vulnerable groups. We know that chronic diseases like heart disease, cancer, and diabetes are the leading causes of mortality, illness, and disability in the Caribbean, representing almost 8 out of every 10 deaths. Before COVID-19, prevention and control measures for chronic diseases were already insufficient. In some countries, resources to tackle NCDs have been further reduced as they are redirected to respond to COVID-19. On top of this, the severe economic impact of the pandemic, particularly on the tourism sector, has also brought sweeping consequences for livelihoods, as well as people's physical and mental health. Pandemics also create a demand for evidence to develop health policy. However, reliable scientific information can be difficult to come by during a health crisis. News travels fast, and the public gets much of its information from social media. At the same time, the COVID-19 pandemic has seen a reduction in public trust in science. Regular transmission of falsehoods and mis- and disinformation greatly complicate public health messaging. While evidence and communication are key, I must come back to the fundamental importance of building strong and resilient health systems to make certain we are far better prepared for the next pandemic. This requires health systems based on a primary healthcare approach and improved surveillance capabilities that recognize the interconnections between social, economic, and environmental risk factors. With the above in mind, some important questions remain. Will the crisis be a catalyst for broad policy changes and recognition of the importance of health for economic prosperity in all sectors? Will countries invest more in health services and health workers? If that is the ultimate transformative result of the COVID-19 pandemic, it will be a silver lining indeed to the collective global crisis we are now living through.